Hello, today we are going to talk about holiday blues. Your mental health matters. I'm Jana with Alt Care Wellness. What is anxiety? Anxiety is the apprehension, anticipation of future danger or misfortune accompanied by a feeling of worry, distress, and/or somatic symptoms of tension. The focus of anticipated danger may be internal or external. When you experience an internal fear, it can present as dizziness, muscle tension or pain, restlessness, sleeplessness, trouble focusing, racing heartbeat, fast breathing, shaking or trembling, stomachache, diarrhea, loss of energy or appetite, sweating, cold, sweaty hands, chest pain, and/or dry mouth. What is depression? Depression is the feeling of being intensely sad, miserable, and/or hopeless. Some describe an absence of feelings and/or dysphoria, difficulty recovering from such mood, pessimism about the future, pervasive shame and/or guilt, feelings of inferior self-worth, and thoughts of suicide or suicidal behavior. When you experience a low mood for an extended period, it can cause trouble with mental tasks such as remembering, concentrating, or making decisions, make you feel nervous and jumpy, cause trouble sleeping, or you may sleep too much. Change in your appetite can cause headaches, stomach aches, and other aches and pains, drain your body of energy, and may cause feelings of helplessness or hopelessness. What is seasonal affective disorder, or SAD? This is a type of depression that's related to changes in seasons, and we have discussed this topic a little bit in the past. But since we're talking about the holidays, this is a good time to bring this in, as seasonal affective disorder usually starts happening in the fall. SAD usually begins and ends at about the same times in every year. Most people with SAD symptoms start in the fall and continue into winter months, sapping your energy and making you feel moody. These symptoms often resolve during the spring and summer months. Less often, SAD causes depression in the spring or early summer and resolves during the fall or winter months. So we're seeing this more and more in the fall and winter months, especially in areas where it's cloudy most days and gets dark super early. During periods individuals are experiencing SAD, any or all of the following may occur. Feeling listless, sad, or down most of the day, losing interest in activities you once enjoyed, having low energy and feeling sluggish, having problems with sleeping too much, experiencing carbohydrate cravings, overeating and weight gain, having difficulty concentrating, feeling hopeless, worthless, or guilty, having thoughts of not wanting to live. What is stress? Stress is the pattern of specific and non-specific responses a person makes to stimulus events that disturb his or her equilibrium and tax or exceed his or her ability to cope. When you experience internal or external stressors, blood pressure may rise, heart may pound, muscles may tighten, stomach may become tense, concentration may get worse, forgetfulness may get worse. Some NAMI statistics, and this is the National Academy of Mental Illness. In 2014, NAMI reported 64% of people with mental illness say the holidays make their conditions worse. A newer survey completed in 2021 showed that 3 in 5 Americans feel their mental health is negatively impacted by the holidays. Holiday impact on mental health. Increased financial burden due to travel, gifts, and/or hosting costs. Increased physical and mental demands. A packed calendar of parties, performances, and traveling that can be difficult to balance with everyday responsibilities and self-care. Expectation to give perfect gifts and plan perfect events, as well as the increased commercialization of the holidays. Dealing with the loneliness for those who aren't with loved ones, or the emptiness of loved ones who have passed. Seasonal changes, including decreased exposure to sunlight and the overemphasis of the end of the year. According to Psychiatric Association, in a 2017 survey, both men and women are noted to experience significant stress increase during the holidays. 44% of women and 31% of men report an increase in stress during the holidays. Some self-care strategies. So manage your finances. Avoid overspending. Set a limit and stick to it. Have a budget. Know your limits. Do not overbook yourself. Say no when you need to. Make self-care a priority. Meditation and exercise are great to combat depression, anxiety, and stress. Spend time in fresh air and sunlight whenever possible. There are numerous studies supporting a short walk outside can decrease a multitude of symptoms related to your mental health, including symptoms of SAD. Set responsible expectations for yourself and others. Be mindful of your expectation of yourself and others. This can be an overwhelming time for everyone. Find ways to give back. Donating time, money, food, or even used items can give you a sense of meaning and purpose for the holiday. Avoid drug or alcohol as coping mechanisms. There is a 20% overlap between people with anxiety or mood disorders and substance use disorders, and substances can exacerbate symptoms. Avoid triggers. Don't participate in it if it brings you sadness. Make new, fulfilling memories. Self-care and self-love for the holidays. Anxiety. Engage in familiar activities. Meditate. Depression. Engage in activities you enjoy. Spend time giving back. Seasonal affective disorder. Get fresh air and sunlight as much as possible, and maybe some therapy, light therapy. Stress. Schedule time to relax. 30 minutes of exercise a day. And there's our sources. Thank you so much. I hope you enjoyed this presentation. Have a safe and wonderful holiday season.